Another record-breaking day for new coronavirus cases in the U.S. On Thursday, the country added more than 88,000 new cases. That is a single-day record to bring the total number of positive cases in this country since the start of the pandemic above 9 million. Another 971 deaths also reported on Thursday. Now, as we've said, the U.S. reached yet another milestone in the ongoing battle against the virus. Joining us tonight to talk about this is Dr. Stephen Thomas, professor of medicine, microbiology, and immunology at SUNY Upstate Medical University. Dr. Thomas is also the chief of the university's infectious disease division. Dr. Thomas, we appreciate you being here, but another grim night when you talk about these numbers. We saw, as I said, over 88,000 new cases in one day, single biggest spike we've seen since the U.S. Started this pandemic. What's your reaction? Why now are we seeing the increase?
Well, I think there's a few reasons, but we can start with the basics. So this is a respiratory virus. So the way that it is transmitted is when you have an infected person coming in close contact with an uninfected person. That's the first thing. The second thing we have to remember, this is a more infectious virus than influenza. So a single infected person can infect 2 to 4 other people. So when you have risk factors such as people not doing public health interventions like having gatherings, not physically distancing, not wearing masks, not getting their flu shots, you can get this momentum going where you have multiple people infected who then infect 2 to 4 more other people, who then infect 2 to 4 more other people, and you can quickly see this very steep rise in the number of cases.
Are you concerned about the burden on healthcare staff, facilities, when you talk about capacity at hospitals and also PPE in the months ahead as we see numbers go up?
Yeah, that's a great question, because that gets to the basic concern that we've had about COVID from the very beginning, is that, the U.S. healthcare system operates at about 90% capacity on a normal day when we're not in a pandemic. And so when you take 320 million people who are not immune to a respiratory virus, and then that virus is rapidly transmitted across the country, you overwhelm the healthcare system very, very quickly. And so what that means is you lose, emergency departments are full, medical surgical wards are full, intensive care units are full. So what that means is that people who want to come to the hospital because of their COVID, they're not going to be able to be treated adequately, and those people aren't going to do well. But at the same time, you have the people that have heart attacks and strokes and who are involved in trauma. They also cannot access the healthcare system, and that's where we see a lot of death and the huge public health burden from COVID.
Let's talk about some of the measures being taken. For example, as we mentioned, states like Illinois are adding more precautions just within the last few days. No indoor dining. Do you think measures like this will make a difference as we move forward?
They do make a difference, and we know that they make a difference. We've seen this not only in our country, but we've seen it in other countries, primarily because it takes away an opportunity or a venue for people to come close together, for people who are not wearing masks or not physically distancing. It takes that opportunity away. In fact, we're in a pandemic, and we're certainly within an epidemic in the United States, but infectious diseases can be very much a local phenomenon. And so what I recommend is that, local counties and states have to see what's going on in their particular region. They have to have triggers for doing things such as, no public, universal masking, closing down restaurants, closing down bars, not having gyms open, not having in-person learning. And those types of triggers should be, what is the % positive test rate in our area? What do the hospitalizations look like? What are the ICU capacity? What does that look like? And you should just develop what these triggers should be to act, and then you should act.
Dr. Thomas, tomorrow obviously is Halloween. Some states are allowing trick-or-treating. Others have put restrictions in place. What is your advice as parents make plans for tomorrow night? And then I think also looking forward for Thanksgiving as well.
Yeah, I had different advice about 6 weeks ago, where I thought there was a way that it could be safely done. But I've changed my mind a little bit when I've seen what has been consistently going on in all parts of the country, including where I live in central New York. So I really can't endorse door-to-door trick-or-treating right now. What I can endorse is that people think a little bit more creatively about how they can celebrate the holiday with their children. So very, very small groups. Try to have activities outdoors. Do not have activities that have kids coming close together for any prolonged period of time. Those are the types of activities that I can endorse. But unfortunately, I don't think door-to-door trick-or-treating is a good idea this year.
And real quickly, with just a few seconds left, your advice for Thanksgiving and the holidays?
Yeah, Thanksgiving. I think you need to rethink your plans this year. If you're a family that has lots and lots of people come over and lots of folks from your family unit come over, I think this needs to be a very small social circle year, because interstate travel, I believe, is a really bad idea. And, I agree with Dr. Fauci on this point. I think you have to be very lean this holiday season and keep it small.
All right. Well, as for Halloween, we are doing an indoor candy scavenger hunt at my house tomorrow, Doctor. So we'll see how the kids like that. Stephen Thomas, Doctor, we appreciate your time tonight. Thank you.